Welcome to Health Literacy Out Loud. I'm Helen Osborne, President of Health Literacy Consulting, founder of Health Literacy Month, and author of the book Health Literacy from A to Z. I also produce and host this Health Literacy Out Loud podcast series that focuses on many aspects of health communication, patient education, and health literacy. Today's recording is a fascinating conversation with two medical clowns from the Hearts and Noses Clown Troupe based in Needham, Massachusetts. Unfortunately, technology is not always perfect. You might notice occasional audio glitches due to processing problems. Cheryl Lekousi is the executive director of Hearts and Noses. In her work as a clown, Cheryl is referred to as Tic Toc. Building on an extensive background in special needs education and early childhood development, Cheryl now makes clown visits to pediatric hospital units, memory care facilities for older adults, and a range of community events for ill and disabled children. Kenny Raskin is the artistic director of Hearts and Noses, training the troupe in clowning skills, partnering, and sensitivity to hospital staff and patients and their families. As a clown, Kenny is known as Dr. Mensch. Kenny is recognized internationally for his skills as a physical comedian and clown. He has performed in numerous films and circuses and television shows and stage production. Kenny even was the comic sidekick of the villain Gaston in the Broadway production of Disney's Beauty and the Beast. Welcome to you both, the Health Literacy Out Loud.
Thank you, Helen. It's lovely to be here.
Thank you.
I have read a number of articles on hospital clowns. I always have a smile on my face as I read them, and I've long been intrigued. What a joy to finally be talking with actual clowns. So let's take this from the beginning. What is a hospital clown or a medical clown? Explain it to all of us, please.
Well, the first thing is we study clowning, the tool of clowning and character, which is very important because that's the tool we're using to go into a very fragile environment. We then study what is a hospital like, where can we go, do we need to gown and glove. We learn all of the background of the hospital.
Okay.
That gives us time to be able to go into a room. And when we get into the room, and we'll break down the steps as we talk, but when we get into the room, the goal is not to perform. We need things in our pockets that we can do, certainly. But what we're trying to do is find the game, find the yes.
Find the what?
The yes.
Find the yes. So wait, let me just get this picture here. This is familiar to you because you do this in your work as hospital clowns. I worked in hospitals, but now you're dressed up looking like a clown?
We are dressed as characters, and the characters are a clown, but we don't have white face or wigs or gloves. We don't have a ruffled collar. I'm a childlike clown, but I'm a middle-aged woman. It's obvious when they see me. But because of the way I dress, Mary Jane shoes, I have bloomers, I have a little dress on.
You have a red nose?
I have a red nose.
Okay, that to me is the clown. Okay.
Yeah.
That's when you become the clown.
Yeah.
But I'm a character.
Okay.
So I'm also, actually, I'm dressed as a goofy doctor, actually.
Okay.
Dr. Mensch. This whole medical clowning world really began back in the late 80s or the 90s by a guy named Michael Christensen, who was one of the founders of the Big Apple Circus.
Oh, okay.
And he was invited to come speak to doctors, and he came as a doctor clown and came speaking to them. He once said that that one doctor, if I'm in the hospital, says, clowns don't belong in the hospital. And he said, well, neither do children.
That wow.
Right back to, but so we have different personas. Some of us dress as Dr. Clowns in a white coat, usually with, patches on it and stuff like that. And always the red nose and maybe a floppy hat, baggy pants. But not a circus clown, but
Okay.
an oddball, if you will. And I
Okay.
like to say that our job is to bring clown reality into the room because the medical reality is one thing, and it can either be boring for a child, or scary for a child, or stressful for a family. And we bring clown reality in to the room to try to just change the energy for the time that we're in the room with them.
Thank you. Now I want to picture this a little more. So now I have this image of both of you and your personas of some variety in there. Cheryl, you mentioned there you need to get the yes when you enter a patient's room. That seems disconcerting to me. Like, how would someone who's sick or in bed or terrified or something all of a sudden say yes to this ridiculous looking character about to walk in? How do you get to that yes?
Well, we train extensively in what's going on in the room. As we walk up to a room, we're looking around the door. Is there precaution? Do we need to gown and glove? So that when we step into that doorway, we stop. We connect with our eyes, we connect with the breath, and let them know we're there. And there's lots of ways to ask permission. You can say, "Can I come in?" But if it's a teenager who's just looking bored, I might say, "Hey, this is a lovely apartment. Is it going to be up for rent soon? Can I
Oh,
check it out?"
okay.
Um,
Yeah, I once went into a teenage boy's room and he was on his phone or something, and I looked at him and I said, the door, I said, "Hey, what are you in for?" I didn't mop the floors right, so I'm in. That's why I'm here. Why are you here? So it just depends. There's a lot of ways to get yes. You look at the kid, and if the kid is looking scared or uninterested, we might try a little bit, but if they don't want us, they don't want us.
Okay, do you also need a yes from the hospital staff? You're not surprising anybody, really.
no.
And did they say to you, patient over there maybe could use a smile today? Did they suggest that?
Yeah, each hospital has their own criteria of what we do. In some hospitals, they know we're coming and they're busy, and we go room to room and we are trained to look for rooms that we can't go into because of medical droplet precautions or anything like that. We don't go into a room where the kid's sleeping.
Right.
You wake it, you take it. Um, in other hospitals, we'll check their census before we get there and give us an actual list of who we can try and see.
And sometimes we'll say, is there anybody that really we should not go to? And they say, yeah, yeah, he's really having a hard time today. Who knows whether it's a hard time because medically or he's depressed. So as we build relationships with the nurses and they trust us, we might be able to say, is it because he's sad? And they say, yeah. Well, do you mind if we check it out? She said, yeah, go ahead. Just we don't want to be medically intrusive, but we're there for their psychological well-being.
Oh,
When that means we get permission from anybody else in the room too. If a
Yeah.
parent is sitting there, we'll make eye contact with them because we don't know. Maybe they were trying to get that baby to sleep.
mhm.
And if they shoo us away, we go away. And if you think of the hospital environment, who else can that child say no to? Even a janitor will just come in and clean the bathroom.
Okay.
So we're giving them a little bit of empowerment by getting permission to be there. And that permission continues throughout the visit. It is not the show must salon. It's all child centered. Whatever we're doing is about that child. If they're having a great time but suddenly start to fall asleep, we're done.
We're done. Okay. I'm really appreciating this because you really are painting a picture for me. Can one of you just tell a story and make it more real for all the listeners? So now you have the yes. How old a child do you want to deal with a child? How old a child do you want to deal with this? Are the parents in the room? Just walk us through this a little bit. And then I want to find out kind of the upside for the patient, for the family, and your reaction.
Well, I could give you a story about something that happened just last week. As Kenny said, sometimes the staff will go, "Oh, they're a little old for clowns," or "He's really nervous." I was in a pre-op area. There was a teenage boy who was terrified, would not change into his gown, didn't want anybody near him. His mother was with him. Child Life went in, the doctor went in, the nurse went in, the anesthesiologist went in, answered all his questions, but he was still very, very scared. While those people were in the room, I, Tic Toc, made sure that I walked by the doorway a couple of times so that he saw me. He
Okay.
knew I was out there. When everybody else left, I peeked in and I said, I'm here for little kids, but can I hide in here?
Okay.
And he said yes, and the mother was super into me. She immediately started taking pictures. I was making offers to this kid of magic, of stories, of all these different things, and he kept saying yes. And at one point I said, do you want me to stay or do you want me to go? And he said, I feel better that you're here.
Okay.
I stayed in that room 45 minutes.
Wow.
I went through everything I had. And I was telling him, I only have little kids stuff now. And he said, tell me a story. And I was masked, by the way, because it's flu season.
So you were masked, but you have your red nose and you're telling stories. But he said for all these intrusive medical people, you're the only non-medical person there.
Right. And he could control me. I ended up telling him a story about Halloween with the voices of the witch and the ghosts and all that. He started to laugh.
Oh.
And he said, I love the voices. And I said to him, yeah, you can't even see my lips move. When he was rolled away, his mother handed him her phone, and he went into the OR looking at the pictures she had taken of us.
Oh, Cheryl, I'm getting goosebumps hearing this. Thank
I
you
have some good medication for that if you need.
for the goosebumps.
Yes.
What's your goosebumps for me?
I don't know. So I remember a situation about 7 years ago. I was in the hallway of the hospital, and this little girl was pushing a walker down the hallway, and her father was behind her, and I gave her a big hello, and she went, she kind of recoiled a little bit, and I backed up, and I said, well, I'm going to go on a parade. If you feel like joining me, join me. And I
Okay.
started playing my ukulele and walking down the hallway and immediately bumping into the wall or tripping over this as I was playing. And I was playing, I think I had a kazoo in my mouth.
Okay.
And my partner was with me, and we were making a parade. And I looked back, and she was walking and walking with us and walking. She was, maybe
Oh,
about 20 feet away, but she was walking, and she was laughing and smiling. And at the end of it, she went back to her room, and we paraded her back to her room.
all right.
And at the end of it, her father said, she hasn't smiled in 2 weeks. Thank you so much.
Oh,
This happens a lot. I mean,
this is the point of having us there, is we're there for the whole child. We're not there because they're sick. We're there because where they are and the whole of them. We're looking for play. We're looking for childhood. I had a mother once say to me, I told the child a story. I haven't thought to read them a story since we've been here because it's a very serious place.
Yeah.
oh, thank you.
I used to work with a clown named Nurse BB, who is such a marvelous human being, and he just wrote a book about his experience as a hospital clown. But one of the things he talked about was the boomerang.
Okay.
And the boomerang is that the man saying, thank you so much. She hasn't smiled in 2 weeks. But the real boomerang is when you go in and you connect with the child. Maybe it's a baby or something. The mother's been sitting there. God knows what she's been thinking and how much stress she's under.
Right.
And you look over and she's crying.
Oh,
And that's called the boomerang. You work with the kid, and boomerang over to
okay.
the adult.
And I assume that the mom crying is a good thing.
It's a good cry.
It's a good thing.
It's a relief.
Comedians do that. I've been to presentations of comedians and they go, I really slayed them. I
Yeah.
killed it. And I
Yeah.
thought, like, what you weird use of words.
Yeah, we probably don't use that word in the hospital.
Okay.
Yeah, we're cautious of our language. We have talked about we are now also in memory unit.
Yes,
For
I'm
elders.
curious about that.
Our outfits are very different. We are playing to a different group of people. I look like I walked out of I Love Lucy and put on a red nose.
Oh, okay.
My name there is Miss Millie because Tic Toc doesn't make sense to that. One time, Kenny and I were going.
Not Kenny.
I'm sorry, Mr. Mensch.
Melvin Mensch.
Melvin Mensch, who has now become my clown husband
Yeah.
in memory care. We peeked into a room to see if someone wanted us to come in, and there was a woman sitting in her chair, gripping her walker, white-knuckled, and she looked up and she said, nobody comes, nobody ever comes. Well, our energy level dropped to her energy level. I walked over and I squatted so that I was eye level, a little under eye level, and I said, hey, hi, we're here.
Oh.
And we very slowly went from her spot of fear to, oh, what's that picture up there? Because those family pictures. And she started telling us about family. And you saw her body relax. And then Kenny came in with his ukulele. We ended up singing, and she was singing and laughing. And here's the wonderful boomerang. Her daughter, who knows the state that her mother's been in, the fearful state, walked in at that moment to her mother smiling and laughing.
Oh.
So the gift was not only to the resident, but to her family.
Thank you for sharing those stories. Kenny, thank you for laughing at these stories.
Well, I mean, look, we have mostly successes. We don't. It's not that we don't ever get told, "Get the hell out of my room." Which, that can happen too, But you never know what's going on in people's minds and what's going on in the hospital.
It sounds to me as though kind of the role of joy and humor and humanity there. So let me tell you about the podcast listeners and a little bit about health literacy. As far as health literacy, it's all about communicating health information in ways that patients and the public can understand and act on. It's pretty medically, scientifically based in that way. The listeners to this podcast all care about communicating a bit better today than they did yesterday, just picking up some pointers or two. I sincerely doubt that many or any of the listeners are clowns or aspire to be clowns. But I'm hoping from your perspective, you can give us some pointers on how we can add a little bit of joy and humanity to the encounters that we face every day.
Well, the first thing that comes to my mind is before you walk into the room, to take a deep breath, exhale, and walk in and be present.
Okay.
And that means to not only be present to the person, but what's in the room, but mostly be present to the person.
Okay.
And to come in with a sense of respect and a sense of willingness to go wherever the patient is at that moment.
Okay.
If you're not going to do a routine or anything, that's one. I mean, for instance, just to give you an idea, I might say to Cheryl before again, let's do the Dr. Mensch thing. So we'll go in and I'll say, hello, this is my partner Tic Toc, and I'm Dr. Mensch. Don't mention it.
And then
then she says, well,
Dr. Mensch.
No, I said, don't mention it.
Oh,
right?
of course.
Okay.
Yeah, I wanted to let you know what Dr. Mensch.
No. Remember, don't mention it. So we'll go in and, we'll see if that's working, right?
Okay.
Now that's humor. That's a routine that we worked out together. Another routine might be, what's your name? He says, Don. I was, oh, Ron. Yeah. Hi, Ron. No, Don. Oh, yeah, Juan. Yes. I get, no, I hear you. It's Sean. Yeah. I mean, so it could be my goal. And what I try to teach the clowns is, you're the dumbest person in the room. Okay. The child is the smartest. But those are routines, and that's in the clown world. In the other world, the world of just people wanting to connect with sick people, is just be aware that they're sick. Number one, go softly. Go softly. Be very present to what's going on. And I would say don't go in with an agenda.
Okay.
I'd like to add to that. So the skill we're using here that can be used by anybody is, so a medical person's going in and there's something they need to do. But you've got a 6-year-old whose favorite thing in the world is wildebeest.
Is wildebeest?
Yeah. Ask them a question about wildebeest. Go about what you need to do. But think, why are zebras the best friend of wildebeest? Let them be the star. Let them tell you something. It won't take away from what you're doing medically, but it will be more pleasant for that child.
Are you ever with a clinician right there? Like someone's drawing blood or something? Are you there kind of as a distraction or humor, or it's either it's medical or it's you?
It depends on the SAS person. We're always willing to go in and be there to assist. I did, the boy that I just showed you about, the Triton boy, I was there putting stickers on his arm while the opposite of an arm was getting his needle in.
Okay.
Here, I'll give you a story of one. There was a child in the medical rehab unit who was about 2 years old, had a trach tube, and had always had a trach tube, and recently got a new tube that has a speech flap so that they could learn to talk.
Okay.
But they had never talked. So they had a speech therapist in there. We came to the door ready to leave because they were busy. And she said, "Come on in, we're doing some music." So my partner and I went in and we started singing Old MacDonald. And we did some of the animals and the child smiles. It didn't do anything. And then we put the child's name into the song and they grunted with the says.
Oh,
It was the first vocalization that child was doing. And what we did, we made the child the star
yeah.
and the most important person. So we do sometimes, and sometimes they shoo us away. We don't have an ego. If someone says go away, we're like,
I know that there are some national groups or, groups across the US, I don't know if they're international too, doing this kind of work. How common is that?
Very, very common. Cheryl and I have been lucky enough to go to several international conferences. I'll bet there's over a couple of thousand people
Oh my
in the world
goodness.
doing this work. Yeah, in Europe, a lot of it's funded by the government. We're not so lucky, and Israel's got a very big program. Japan, China, Australia, New Zealand, all over Europe, Brazil,
Wow.
and where is the next one?
no.
Switzerland.
So, for all the scientific people who are listening to this, are there any outcomes or studies looking at this? I mean, it's fun to listen to your stories, but does it make a difference?
Absolutely. I mean, the conferences we go to, we have doctors come and talk. We have the clinicians come and talk. There's a lot of studies. If they go and look for the literature, you'll find there's a lot of studies that say this stuff is very powerful in a medical environment. This bringing what we call relief to patients. As a matter of fact, a colleague of ours, Amnon Raviv in Israel, he has a he has a doctorate in hospital clowning. He created
Really?
a doctorate in hospital clowning.
Oh,
I will say that our website is in the middle of being redone, but our website will have some of these studies attached.
good.
And
Thank
if
you.
you are interested, I can give you one synopsis of one study that I remember.
Please do that. And I also want to tell listeners there will be on your Health Literacy Out Loud webpage, we'll have a list of some resources, including the one for your specific organization. So thank you. One last story as we put a pause in this conversation. So Cheryl, you're on.
So there was a study done in Israel, and it was about children that needed an MRI. The doctor that was in charge of this unit noticed that the clowns always came on Tuesdays, and he said, let's do a study. Let's measure the kids that need to be sedated to get an MRI and don't need to be sedated because they're the clown. 147 patients, 144 of them worked with the clown for a certain amount of time before going in. The clown went into the room with them.
Oh, okay.
Worked with the people behind the glass that was doing the MRI. 144 patients did not need sedation out of 147.
Oh my
And the
goodness.
doctor said, I think the other 3 were actually on the spectrum. So we think it's that. There's some real studies out there showing where it helps.
Wow. Oh my goodness. Thank you. Thank you both so much for all you do, whether you
Thank
as
you.
people and experts and skilled in what you're doing, and you as personas for bringing the humanity and the joy to what could otherwise be a very difficult situation. I'm delighted you were guests on Health Literacy Out Loud.
We thank you very much.
Thank
Thank
you.
you.
As we just heard from Cheryl Lekousi and Kenny Raskin, it's important to add a dose of humor and humanity to all that is medical. But doing so is not always easy. For help clearly communicating your health message, please take a look at my book, Health Literacy from A to Z. Feel free to also explore my website, healthliteracy.com, or contact me directly at helen@healthliteracy.com. New Health Literacy Out Loud interviews come out the first of every month. You can get them all for free by subscribing at healthliteracyoutloud.com or wherever you get your podcasts. Please help spread the word about Health Literacy Out Loud. Together, let's tell the whole world why health literacy matters. Until next time, I'm Helen Osborne.